Hello dear aspirants, welcome to KNO Academy. So again, I'm going to continue the MCQ session here, okay? So MCQ session, that is most advanced questions. Most advanced MCQs from the national health programs, okay? National health programs and also from the NORCET theory, okay? So we have to always concentrate more on the national programs, okay? Very important. Because we can see the last okay now 2 3 NORCETs they have asked more questions from the national health programs like Ayushman Bharat, okay, Anemia Mukt Bharat, okay, TB Mukt Bharat, like this, okay. So we'll move on to the first question now. Question number one: when the National Newborn Week is observed? Okay, when the National Newborn Week is observed. So options are November 15 to 21 and December 15 to 21, October 15 to 21 and August 15 to 21. Okay, so here the answer is November 15 to 21. So don't waste the time like these questions. Okay, so I will tell you. So this National Newborn Week, okay, is initiated by the Ministry of Health and Family Welfare. Okay, Ministry of Health and Family Welfare in the year 2014. Okay, so this much is more enough for this program. Okay, National Newborn Week, okay, initiated under the Ministry of Health and Family Welfare in the year 2014. Okay, so right answer is the November 15 to 21, 1 week. Okay, we'll move on to the next question. What is the Nikshay Mitra initiative? Okay, Nikshay Mitra initiative under the Pradhan Mantri TB Mukt Bharat Abhiyan. Okay, so you may heard of this Nikshay. Okay, so option A is the additional diagnostic, nutritional, and vocational support to those on TB treatment. Okay, and option B is the to provide a platform for the community support for persons with TB. And option C is the financial support to the TB persons. And option D is the option A and option B. Okay, so here the right answer is same. Option D is the right answer because this Nikshay Mitra, okay, was launched in the year 2022, okay, September 9 date, okay, September 9, 2022, okay, under the same Pradhan Mantri TB Mukt Bharat Abhiyan, okay. So the main intention is to provide the additional diagnostic, okay, additional diagnostic, nutritional, and vocational, okay, support to the TB treatment patients. Okay, and also to provide the platform for the community support for the persons with TB. Okay, here we can see the Nikshay Mitra how is working. Okay, so Nikshay Mitra is okay. Here we can see ensuring support to the TB patient with a diagnostic support, nutritional support, and vocational support. Okay, and one more thing we should know, that is the Nikshay Nikshay portal. Nikshay portal is for the notification of TB cases. Notification of TB cases. Okay. And one more thing, Nikshay Poshan. Nikshay Poshan. Poshan Abhiyan, you may heard this. Okay. So Nikshay Poshan, this is the like financial support to the TB patients. Okay. Monthly 500 rupees for the nutritional support. Okay, Nikshay Poshan is for the monthly 500 rupees government is giving for the nutritional support. Okay, and one more thing, that is a Nikshay Portal 2.0. Nikshay Portal 2.0. This is for the if any person, a representative, or any organization can adopt the TB patient, and the adopted patient will be taken care. Okay, so hope you understood. Nikshay Portal is for the any person or organization can adopt the TB patient. Okay, so we'll move on to the next question. What is the preferred solution for the dilution of quinine? Dilution for the quinine used in the severe malaria. Okay, so option we can see 3% sodium chloride. We never use the sodium 3% sodium chloride for the any dilution of the injections or anything. Okay, and ringer lactate. Okay, this is also very rarely we're using. 5% dextrose. Yes. So for the dilution of the quinine solution, we are using the 5% dextrose, not the dextron. Okay. So here I will see. I will say sorry. I will say why we are using the 5% dextrose for the dilution of quinine. Okay. So quinine, the most adverse effect is it leads to the hypoglycemia. Hypoglycemia. So to avoid the hypoglycemia, we are using the 5% dextrose to the dilution of the quinine powder. Okay. And one more thing, what are the parameters we need to monitor during the infusion of the quinine? Okay. That BP we have to monitor vitals anyway. Okay. And blood glucose, very very important, because I told you it leads to the hypoglycemia, and also we need to monitor the ECG also. Okay. So this is the for quinine infusion. Then which question number 4, what is the antithyroid agent preferred for the treatment of hyperthyroidism? So this is very important, hyperthyroidism during the first trimester of pregnancy. Okay, during the first trimester pregnancy, which is the safest drug we are asking. So that is the options are methimazole, option B the propylthiazole and carbamazole, and the levothyroxine sodium. So here we can directly say that levothyroxine we are using for the hypothyroidism. Hypothyroidism, we should know. Okay, levothyroxine is the used for the hypothyroidism, and carbimazole and methimazole both are the same group of drugs. Okay, carbimazole and methimazole. Okay, and here propyl thiazole is the PTU. Okay, PTU. So which we are using in the first trimester. This is the safest drug during the first trimester. Okay, so propyl thiazole is the safest drug during the first trimester. Why we are not using the methimazole and carbimazole? Because methimazole and carbimazole, okay, induce the toxicity, okay, fetal toxicity. So many okay studies suggesting that do not use the methimazole and carbimazole. That's why we are using the only propyl thiazole. But in case of second and third trimester, we can use the methimazole and carbimazole. Okay, hope you understood. And one more thing I have to tell you here. So methimazole, suppose if we are giving this propylthiazole, so what should be observed? So what is the adverse effects? What are the things to be monitored during this? So it leads to the agranulocytosis, agranulocytosis abnormality in the WBC. Okay, so neutrophils may decrease. So we have to monitor the this one WBC. Okay, so during the infusion of propyl, sorry, this is during the administration of propylthiazole. Okay, we'll move on to the next question. What is the preferred disinfectant used to clean the site of blood withdraw for the blood culture? For any invasive procedures, we are using always like spirit, betadine, spirit, betadine, spirit. Okay, so this we should keep it in our mind. First, we have to use the spirit, okay, to clean the area, and for betadine we are using to disinfect the area, and again we are using the spirit for the quick drying of the betadine. Okay, so this is a process we are doing invasive procedure. Okay, spirit, betadine, spirit we have to use. Okay, this is also important question. Okay, and we here we'll see only they're asking 70% isopropyl alcohol or 2% glutaraldehyde or 7.5% betadine or 2% chlorhexidine gluconate. So here we can see this 70% isopropyl alcohol only we are using for the what we are using for the cleaning of monitors and for the hand rub. Okay, we can use for this 70% isopropyl alcohol. This 2% glutaraldehyde we can see for the processing of instruments, that is bronchoscopy, okay, laparoscopy, okay, probes. Okay, we are using for the disinfection or sterilization of these probes, and also for the any sharps, okay na, Sharps means scissors. This 2% glutaraldehyde we're using. So this, once we open the bottle of this 2% glutaraldehyde bottle, this validity for the 14 days. Okay, every 14 days we have to change the solution in the tray. Okay, that we should keep it in our mind. And if soiled, suppose if, okay, using many instruments togetherly, okay, in the tray. Okay, suppose I'm telling this glutaraldehyde tray. Today I am pouring the glutaraldehyde solution. Okay, I'm pouring the equipments. Okay, in this one, after that, okay, after sterilization, I'm removing. Suppose if one day only I am replacing many instruments, this can, this solution become soiled, then we can change immediately, or else this solution is valid till 14 days. That also we have to learn. Okay, and 7.5% betadine. 7.5 betadine, yeah, this is the right answer actually. So 7.5% betadine we can use for the disinfectant of the cleaning the site for blood withdraw for the blood culture. Okay, and 5% betadine also coming. Okay, we can see that. Okay, and 2% chlorhexidine gluconate. 2% chlorhexidine gluconate we are using for the scrubs. Okay, scrubs like hand scrubs. Okay, hand washing and all, and also for the body wash. Bed bath we are giving now, that time we are diluting the 2% chlorhexidine gluconate, okay, in the water, and we can give the bed bath. Okay, this is also very important. See, one question, so many options. So in that so many options we have to learn which option is related to which. Okay, so that is very important. Okay, so hope you understood. And next question, what is the drug of choice for complicated malaria in first trimester? Complicated malaria in first trimester pregnancy. Okay. Option A is the doxycycline. Option B is the parenteral artemisinin. This is also known as artesunate. And option C is the parenteral quinine and primaquine. So here we have to see the right answer. We have already previously one question we have discussed. Okay, that is the parenteral quinine is the right answer. So we know it is a quinine infusion we are giving with the 5% dextrose. 5% dextrose we are giving with the parental quinine. Okay, infusion. And we know this leads to hypoglycemia. So we should be very careful. Patient should be having the food that time. Okay, and we'll see what all are the complications. We can see in the malaria, severe malaria in pregnancy. We can see that the main things. Okay, that is impaired consciousness, pulmonary edema. Okay, and convulsions may happen. Okay, DIC, that is disseminated intravascular coagulation, and also jaundice, severe anemia it will be there. Okay, then hypoglycemia we all know, then acidosis will be there. Okay, so this is the complications of the complicated malaria in pregnancy. Okay, so this we should be very careful. And also recurrently the suffering from the hypoglycemia, that is very important. And we'll see the doxycycline and artemisinin and primaquine here. Okay, so one uh, doxycycline. Okay, doxycycline, this is contraindicated in pregnancy. Okay, we should know this is contraindicated in pregnancy. Okay, so don't forget. And also this drug we are avoiding the children also. Children with the age group less than 8 years. Okay, so it may lead to the staining of the teeth, permanent staining of the teeth. That's why we are avoiding the in children below 8 years. And we'll come to the artesunate. Okay, artesunate. So this is indicated in the second and third trimester. Okay, ultrasound can be given during the second and third trimester. So we should know which is the diluent for the ultrasonate is the sodium bicarbonate. Sodium bicarbonate. Okay, and also after that further dilution into NS. Okay, we can do it. And one more thing, that is the primaquine. So this is absolute contraindicated in pregnancy. Okay, pregnancy, and also hemolytic anemia. Hemolytic anemia, and also in case of G6PD deficiency. Okay, so in these conditions we are not giving the primaquine. Okay, so artesunate can be given in the second and third trimester, but in the first trimester we are giving only quinine. Okay, doxycycline is contraindicated in pregnancy and also in the less than 8 years of child group. Okay, so we'll move on to the next question. Which of the following is incorrectly matched? Yeah, this is AIM's favorite questions. Okay, so even last previous NORCET also we can see that many questions asked the match the following. Questions also repeated many times. Okay, questions also repeated with the same conditions. Okay, so we can see here. Okay, option A is the blue man syndrome is amiodarone, red man syndrome vancomycin, gray baby syndrome propofol, and purple glove syndrome phenytoin. Okay, so here directly we can say, because so this everyone who are preparing for NORCET, everyone knows this. Okay, blue man syndrome is due to the amiodarone, and red man syndrome is due to vancomycin, and gray baby syndrome is not with the propofol. And this we can see to the phenytoin, purple glove syndrome will happen. I will show that image also. Okay, phenytoin, this is also right. So incorrectly matched is the, that is gray baby syndrome is not related to the propofol. Okay, so then gray baby syndrome, how it will happen? Due to the chloramphenicol. Chloramphenicol is related to the gray baby syndrome. Due to the administration of chloramphenicol, okay, gray baby syndrome will happen. Okay, then propofol, okay, we are using for the induction of anesthesia, and also for the sedation we are using to the ventilator patients. Sedations. Okay, and one more thing we should know here, that is the contraindications of the this propofol is, okay, eggs, eggs allergy and egg products allergy, and also soybean. So any persons is allergic to egg and egg products and also soybean, we need to avoid to give the propofol. Okay, so one NORCET they have asked, okay, that is they given the vial, propofol vial. Okay, and ask the question, that is image based question. Okay, so name the injection. So white, milky white solution. Okay, milky white solution is always propofol. Okay, so hope you this very important, that is the milky white. Okay, we'll move on to the next question. Yeah, sorry, this amiodarone, we'll see amiodarone, that is a blue man syndrome. Here we can see the areas blue. Okay, this is the blue man syndrome. This is the red man syndrome due to the vancomycin. This is the purple glove syndrome. See, purple color. Purple glove syndrome is due to the which drug? Phenytoin. Phenytoin, another name is Zeptoin. Okay, and one more derivative will come, that is the phosphenytoin. Okay, phosphenytoin. Okay, we can see next. Here we can see that is the blue baby syndrome. Okay, blue baby syndrome. See, here we can see the blue color. That is the it may be due to cyanotic heart disease also. Okay, due to the cyanotic heart disease. Okay, or methemoglobinemia, gray baby syndrome due to the florum penicle. Because of this only, how the gray baby, see here it will like this, due to the florum penicle. And one more thing, bronze baby, okay, that is due to the phototherapy. Here we can see. Then this carbon baby syndrome is the universal acquired melanosis. Okay, so hope it's clear now. We'll move on to the next question. Which of the following, okay, which of the following correct regarding the PMJAY, that is the Pradhan Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Okay, so what is this PMJAY? I think for bank, okay, they are deducting the amount. I think 180 rupees or 200 rupees. Okay, this one monthly they are deducting. That is the uh, sorry, sir, not for the this one. Okay, I'm really sorry, not for this question. Okay, so that is okay, option A, it provides the health cover of 5 lakh per family. Okay, per year for primary, secondary, and tertiary. Okay, they are given primary, secondary, and tertiary. Okay, and option B is that it provides the health cover of 5 lakh per family every second yearly. No, this is also wrong. And option C is the it provides health cover of 5 lakh per family. Okay, every year for secondary and tertiary care hospitalization. Okay, and option D is that it provides health cover of 5 lakh per family every year for the tertiary care hospitalization only. Okay, so here the option C is the right answer. It is giving only to the secondary and tertiary hospitalization every year 5 lakh per family. Okay, this we should know. Pradhan Mantri Jan Arogya Yojana. Okay, this is the Ayushman Bharat. Okay, so when PMJAY was launched, here we can see this may they may ask. Okay, that is the September 23rd, 2018. Okay, so it covers the 5 lakh rupees for family. Okay, we'll move on to the next question. Which of the following true statement with respect to the Muskan initiative? Muskan. Okay, I will tell you. Okay, this is the Muskan logo. Okay, see the options are option A. It aims to okay, it aims to reduce the preventable mortality and morbidity of children below 18 years of age. Okay, and option B is that it provides child-friendly service to the newborn children in a humane and supportive environment. And option C is that it focuses on promotion of breastfeeding practices, and it was launched in the year 2020. Okay, so which is the right means the option B is the right. It provides the child-friendly service to the newborn and children in a humane and supportive environment. Okay, so Muskan. So option B is the right here. That is the launched in the year 2021 with the objectives of same to reduce the preventable mortality and morbidity among the children below 12 years of age. So why option A is not right? Because this is less than 12 years of age. Okay, but here they are given 18 years. That's why this is wrong. Okay, and one more thing, to enhance the quality of care as per the NQAS. NQAS. Okay, who are all working in private health centers and CHOs, they know this. Okay, what is NQAS? Is the National Quality Assurance Standards. Okay, so this assessment, okay, they have some certain sets of standards that has to be followed in the PHCs and hospitals, government hospitals. Okay, and one more thing, to provide the child-friendly service to the newborn and children in human supportive environment. So this is the right answer. Okay, and here I told you why option D is wrong means this because this is launched in the year 2021. In the year of 2021, it was launched. Okay, we'll move on to the next question. That is the SANS. Okay, the SANS program. SAANS SANS program is initiative of Government of India to raise the awareness, prevent and to treat the which of the following childhood disease? Which of the following childhood disease? First, okay, we'll see the option now. First, okay, option A malaria, option B measles, option C pneumonia, option D is the rubella. So then I will tell the SANS long form. Okay, SANS long form. So here we can see that is the SANS means social awareness awareness and actions. Actions to neutralize pneumonia. Pneumonia successfully. So that's why SAANS. N means neutralize the pneumonia successfully. Okay, so it is related to the pneumonia. Okay, hope you understood. Okay, and one more thing, this SANS is initiated in the year 2019. 2019 November 16th. Okay, to accelerate the actions to reduce the death due to the childhood pneumonia. Okay, so prevent the death due to pneumonia. Okay, so it's clear now. We'll move on to the next question. Okay, our next question is the BPAM regimen for the drug resistant TB under the Pradhan Mantri TB Mukt Bharat Abhiyan. Which of the following drug is not included under the BPAM regimen? Okay, I will tell you. Okay, so the BPAM regimen, I will tell you. Option A is the bedaquiline, and option B is the pretomanid, and option C is the levofloxacin, and option D is the moxifloxacin. Okay, so here I will tell you this BPAM regimen we are giving up to 6 months. It is a 6 months regimen. Okay, when we are giving, that is the drug resistant TB. Okay, for the drug resistant. Okay, drug resistant TB patients. Okay, so which is the drug is not included in the BPAM regimen. Okay, so the BPAM regimen involved, okay, bedaquiline, okay, then retamanid and the moxifloxacin. Levofloxacin is not involved. Instead of levofloxacin, that is the linezolid. Okay, these four drugs are included in the BPAM regimen. Okay, so that is the bedaquiline, retamanid, and linezolid and moxifloxacin. Okay, levofloxacin is not included. Okay, clear. And we'll see the next question, that is a term neonate with poor respiration and tachycardia at birth starts throwing seizure. Okay, throwing seizures at 2 hours of life after birth. Okay, immediately after 2 hours of birth, okay, that baby showing the throwing seizures. Okay, what is the next step? Okay, in the management. So as per the IMNCI, I am going to tell you. IMNCI, option A is the check blood glucose and give 10% IV dextrose and IV 10% calcium gluconate over 10 minutes and give IV phenobarbital over the 20 minutes and monitor vital signs and observe for seizure episode. Okay, this we are doing commonly. See, so for the as per the IMNCI, what we can do, that is the option A is the right answer. First step is to always we are giving the blood glucose, check the blood glucose, okay, and give IV dextrose. So this is the very important steps. Okay, and here we can see. Okay, suppose if the blood glucose level is less than 45, sorry, blood glucose level is 45 mg per dl. Okay, means we have to give the 2 ml per kg. Okay, 10% dextrose. Okay, 10% dextrose, 2 ml per kg we have to administer. Suppose if again seizure continues, what we can do, that is the injection IV. Okay, calcium gluconate. Okay, injection calcium gluconate. Okay, that is the 2 ml per kg over 10 minutes we are given. Again further seizure continues. Okay, again if seizure continue for further means we have to give the IV phenobarbital. Phenobarbital dosage will be 20 mg per kg. Okay, then suppose again if seizure continues, we can give the phenytoin, IV phenytoin. Phenytoin same, that is also 20 mg per kg. So this is the national guidelines. Okay, so the right answer is always check blood glucose and give 10% dextrose IV. Okay, we'll move on to the next question. What is the purpose of giving iron dextran? Okay, iron dextran through the deep IM with Z track techniques. Z track is like this. Okay, we all know. Oh, this is very simple questions. Overall preparing for the NORCET, we know what is the purpose of Z track. Okay, directly I am going to tell you that is the to prevent the staining of the skin. That is, see here we are pulling the skin towards one side. Okay, then we are inserting the needle, then pushing the injection, and we are releasing the skin. So it will block this area. Okay, so to prevent the staining of the skin and also to leakage of the blood. Okay, so this is very simple question, and maybe they may ask IBQ also. Okay, for the upcoming article. And then we'll see question number 14. According to IMNC guidelines, what is the preferred IV solution to treat the neonatal hypoglycemia? Okay, if less than 45 mg per dl. Just previous question only we have discussed, that is the 2 ml per kg. C, option C is the right answer. 2 ml per kg of the 10% dextrose. Okay, so this is the right answer. And also suppose one more regimen is there, that is if hypoglycemia identified, okay, blood glucose level is less than 45 mg per dl in well nourished baby. Okay, then less than 54 mg per dl in malnourished baby. Okay, suppose if you found, okay, 45 mg per less than 45 mg per dl in well nourished baby, and less than 54 mg per dl in small nourished baby, we have to do same thing. We have to do the same thing, that is 2 ml per kg of the 10% glucose, sorry, dextrose. This is as per the IMNCA guidelines. Okay, we can give through the IV rapid infusion. Okay, we'll move on to the next question, that is the question number 15. Which of the below condition is indications of folic acid administration? So means when we are administering the folic acid. Okay, option A is penetrating therapy, option B is the methotrexate toxicity, and option C is the pregnancy, option D is the all of the above. So pregnancy, everyone knows pregnancy. So during the pregnancy, we are giving the folic acid, but phenytoin and methotrexate we don't know. Okay, so phenytoin, whenever we are administering the phenytoin therapy, okay, we have to give the folate okay, folate supplements, because it reduces the folic acid, okay, in the body. Okay, phenytoin reduces the folic acid level in the body. Then methotrexate toxicity, the main, this is also we can know, that is the this one, methotrexate toxicity antidote of methotrexate is folinic acid. Okay, so folinic acid is a derivative of the folic acid, same. Okay, so this is the antagonist. Okay, methotrexate toxicity means we have to give the folinic acid. Okay, and one more thing, we can see when the methotrexate we are using methotrexate we are using for the actually, okay, that is SLE, okay, systemic lupus erythematosus and inflammatory bowel diseases, IBD, okay, and vasculitis, okay, psoriasis. Okay, so these any connective tissue diseases, okay, any other connective tissue disorders, we are giving the methotrexate. Suppose if overdose happen, we have to give the folinic acid. Okay, this is very simple. So option D is the right answer. Option D is the right answer. When we are administering the folic acid, that is the Phenytoin therapy also we have to give, methotoxicity, and also pregnancy we are giving. And question number 16. The nurse is caring for a patient. Okay, sorry, nurse is caring for the pregnant woman who is in second trimester. On examination, she had a blood pressure of 170 by 120 mmHg and has a 2 plus protein in her urine. What is the most likely complication of this patient diagnosis? Okay, so option A is the spontaneous abortion, option B is the placenta previa, option C is the fetal growth restriction, and also option D is the fetal hypoxic brain injury. So this is the condition of severe preeclampsia. Severe preeclampsia. Okay, so this is not eclampsia because eclampsia means seizures will be there. Okay, eclampsia means I already taken a class, that is a, if seizure present means that will be called eclampsia. Okay, if BP is more than 170 by 120 is always called the severe preeclampsia. So the main, okay, complication is fetal growth restriction. Okay, during this condition, though this is the fetal growth restriction is the main issue. Okay, how then let's see, high blood pressure, okay, high BP will lead to the placental insufficiency. Placental insufficiency. Okay, then always it leads to the less blood supply to the fetus. So it leads to the growth restriction. Okay, so this placenta previa, this spontaneous abortion, this is not directly related to the preeclampsia. Okay, hope you understood. Then we'll move on to the next question. Question number 17. That is the while treating the while treating an elderly client with the severe nosebleed, the physician has inserted posterior packing to the control bleeding. Okay, after insertion of the packaging, okay, after insertion of the packing, the nurse will closely monitor to the client for which of the following complication. Posterior packaging will be done to the severe nosebleed patients. Okay, so then we'll see the options. Option A vertigo, option B Bell's palsy, option C hypoventilation, option D is the gag reflex. Okay, so nostril packing. Okay, so always nostril packing can be alter respiratory status. Okay, always it okay, related to the respiratory status. Okay, so that's why hyperventilation is the common complication. Okay, so this is the clear cut. Okay, and one more thing I will tell you, option A does not occur to the result of insertion of the posterior packing. Vertigo will not happen just because of the posterior packing. Okay, and Bell's palsy, it's a disorder of the uh, seventh cranial nerve. Okay, hope you know seventh cranial nerve. Okay, Bell's palsy. Okay, it is not and also one more thing, it is not associated with the what, the posterior packing. Okay, this is not involved with the posterior packing. This is the damage to the uh, facial nerve. Okay, that is the seventh cranial nerve. Okay, Bell's palsy. And option D, loss of gag reflex. Loss of gag reflex also does not occur due to the insertion of posterior package. Okay, this gag reflex also not related to the posterior package. Only the thing is hypoventilation. Okay, only the thing is hypoventilation will happen due to the posterior packing of the during the severe nose bleeding. Okay, so hope you understood. We'll move on to the next question. Question number 18. The nurse is performing an endotracheal tube suctioning. Endotracheal tube suctioning. Before the suctioning, the nurse has to pre-oxygenate the client. Okay, na? So pre-oxygenated the client in order to avoid the hypoxemia. Okay, what is the maximum amount of time nurse should suction the client at a time? So just in simple method, we can tell that is the what is the time duration for the suctioning. Okay, total, that is the option A, 10 seconds. Okay, close your eyes and you can say this is the minimal time. Sorry, maximum time. Okay, so suppose if they give an option 10 to 15 seconds, 10 to 15 seconds means you can go for this. Okay, but if they given only 10 seconds or 15 seconds, we can choose the 10 seconds. Okay, the right answer is the 10 seconds. Okay, not more than 10 seconds. But if option varies, we have to go for that. Okay, to reduce the hypoxia. Okay, so anyway, before suctioning, we have to pre-oxygenate. Okay, to the 100% suctioning. But during suctioning, it should not beyond 10 seconds. Okay, we'll move on to the next question. Question number 19, that is the while performing the physical assessment, the nurse observed that the client is taking small breaths at first. Small breath at first, then bigger breath, then a couple of small breaths. Couple of small breaths, then 10 to 20 seconds of no breaths. The nurse documents this assessment finding as, okay, I'll tell you, I will show the this one graphs also. Okay, option A Chinese Stokes respiration, option B hyperventilation, option C the Kussmaul breathing, and option D the Biot's respiration. Okay, so here the right answer is the Chinese Stokes respiration. So I will tell you how it will happen. See, initially observe that taking a small breath, okay, like this. Okay, then at first, then bigger breaths, okay, like this. Okay, then again a small breath. Okay, then again apnea, no breath. So again same. Okay, like this. So patient may initially start with small breath, then go with the high, okay, then bigger breath, then 10 to this 20 seconds of no breath. That is the apnea. Okay, then again he will start the same. So this is, okay, called Chinese Stokes respiration. Okay, Chinese Stokes respiration. When we see the Chinese Stokes respiration during the heart failure, okay, or any dysfunction in the respiratory center of the brain. Okay, dysfunction of the respiratory function of the brain. Okay, so this is called the Chinese Stokes respiration. Here we can see that option B hyperventilation. Okay, so hyperventilation, how we can see, this is the hyperventilation. See the breath, how deep. Okay, how deep, this is the hyperventilation. This is the hyperventilation. Okay, and we can see the Kussmaul breathing. Kussmaul breathing is the rapid breathing. Okay, deep labored breathing. See, suppose if they ask the question, Kussmaul breathing, so Kussmaul breathing, I'm telling, deep labored breathing pattern. Okay, due to the, when we are seeing this Kussmaul, this is the Kussmaul. Okay, so when we are seeing, especially in the case of DKA. Okay, during the DKA, Kussmaul breathing. Okay, don't forget this. Okay, this may also come in your examination. Okay, so this is the how the Kussmaul respiration. See here, see the deep. Okay, so this is the Kussmaul breathing. And Biot's respiration. This is the Biot's respiration. Okay, that is when cluster of breathing. So normally, see here, normally breathing. Okay, so normally breathing, and suddenly apnea, and again you start normal breathing. That is called the Biot's breathing, cluster breathing we call. Okay, and one more thing, when we see the Biot's respiration, it is due to uh, damage to the medulla oblongata. Medulla, damage to the medulla oblongata, or stroke. Okay, or any opioid use. Okay, are due to increased increased ICP. Also we can and uncle or tentorial herniation of the brain. So in that situation, we will see the Biot's respiration. This line is apnea. Okay, so this is the normal. This is the normal breathing. Okay, this is the, I told you, na, this is the Chinese Stokes respiration. So for initially it will be small, then big one, then again small, then apnea. Okay, Chinese Stokes respiration. So don't forget this. Okay, and this is the hyperapnea. This is the hyperventilation, and this is the hyperapnea. Okay, and hyper, this is also This is hypoventilation. See, hypoventilation, see, same only, but here very short. Okay, and this is the tachypnea. This is the this is hypo. Okay, this is the hyper. This is the tachypnea. Okay, so hope you understood the respiration patterns. Okay, this biots and this Chinese strokes and cusmal very important. Okay, biots. This is the biots. This is the cusmal. This is the Chinese strokes. These three are the very important. We'll see next question, that is the question number 20. A patient admitted with Crohn's disease with the representing complaints of fever, diarrhea, cramping, okay, abdominal pain and weight loss. The nurse should monitor for the patient which of the following. Okay. Option 1 is the hyperalbuminemia. Option B is the thrombocytopenia. Option C is the hypokalemia. Okay. Then option D is the hypercalcemia. So hypokalemia is the most expected laboratory finding during the diarrhea. Okay. Hypokalemia is most expected finding in the diarrhea. Okay. Laboratory finding we can see, that is the uh, hypokalemia, potassium levels. Okay. And option B, anemia is an expected development, but thrombocytopenia not. Okay. Anemia can be expected, but not the thrombocytopenia. Okay. And option D is the hypercalcemia. So hypercalcemia we cannot see. Okay. No effect in the calcium levels. Okay. Calcium levels are not affected in the Crohn's disease. Okay. So the right answer is hypokalemia. We can monitor for the during the Crohn's disease. Here hyperalbuminemia. So here we have to monitor the for hypoalbuminemia, not for the hyperalbuminemia. Okay. So hyper should be very careful. We have to monitor for the, because hyperalbuminemia won't happen in the Crohn's disease. Okay, it happened in the hypo. Okay, hypoalbuminemia happened. That's why this is directly related. Hypocalcemia is directly related. So that's why we are looking for the hypokalemia. We'll move on to the next question. That is the question number 21. A nurse has to administer an eye drop. Okay, eye drop and an eye ointment to a client with right eye. Okay, how should the nurse best administer the medications? Okay, here the first one, administer the eye drop first and followed by the eye ointment, and administer the eye ointment first and followed by the eye drop. Then administer eye drop, wait for 15 minutes and administer the eye ointment. And one more thing, administer the eye ointment, wait for 15 minutes and administer the eye drop. So the right answer is the option A. I will tell you. So whenever we are administering the eye drops or eye ointment, first we have to administer the eye drops first, then followed by the eye ointment. Why? Because after after applying the ointment, if we are applying the eye drop, okay, it may wash out. Okay, so the time gap, at least only minimum 3 to 5 minutes we can keep. Okay, eye drops is administered first, and then installation of two medication is always between the 3 to 5 minutes. Okay, to prevent the washout of this eye drops, sorry, the ointment, we have to keep the eye drops first, then eye ointment. Okay, we'll move on to the next question. So, what is the purpose? Does the pilot balloon of an endotracheal or tracheostomy tube is used in the airway management? Okay, this is the pilot balloon. Okay, this is the cuff. Okay, so option A, to minimize the mucosal trauma during the insertion. Option B is the to protect the airway against the aspiration. Option C is the to promote the cuff integrity and pressure. Option D is the all of the above. So directly I will say that is the option D is the right answer. Okay, I will tell you, cuff always to prevent the aspiration. Okay, here I'll tell you, to minimize the mucosal trauma. Okay, to minimize the mucosal trauma during the insertion. Okay, so that possible, I will tell you the cuff pressure will be 20 to 25 mmHg. If suppose if we are keeping more pressure, this to inflate this, okay, that trauma will happen, mucosal trauma will happen. Okay, that's why we are measuring the cuff pressure manometer. Okay, that cuff pressure manometer I have already shared in the NORCET-9 mega test series. Okay, and also in our KNO Academy app that is there. Okay, so then option C is the to monitor the cuff integrity and pressure. Anyway, we are doing this. Yeah, here only we are inflating and deflating. Okay, and checking the cuff pressure also from here only. Okay, then option B is the to protect the airway against the aspiration. I told you from any aspiration coming from stomach, it will prevent here. Okay, that's why. Okay, to monitor that all those things we are using the this one pilot balloon. Okay, so don't forget they may ask. Okay, last time they asked the parts of bamboo. This time they may ask the parts of ET tube also. Okay, we don't know. Okay, so this is the pilot balloon. Okay, don't forget. See all the parts. Okay, ambo bag, ET tube. Okay, and any this one like radiant armor. Which are the instruments you are using in your regular clinical basis? Okay, that all things we should know which are the parts. Okay, and also syringes they may ask. Okay, IV cannula also they may ask parts of IV cannula, parts of syringes. Okay, that we should know. Okay, so the right answer is all the above is the right answer. Okay, we'll move on to the next question, that is the who has given the theory of interpersonal relationship. Okay, so this we have studied in the MSc. Okay, nursing theories. So option A is the Hildegard, Pipla, Florence Nightingale, Dorothy Elizabeth, and Imogen M. King. Okay, so directly we can tell that is the Hildegard. Pipla is the interpersonal. Pipla's theory of interpersonal relationship we have studied. Okay, then we'll move on to the Florence Nightingale. Which theory is from the Florence Nightingale? From the Florence Nightingale, we have environmental theory. Okay, so she's the founder of modern nursing and pioneer of the environmental theory. And Dorothea Elizabeth, that is which one? Self-care theory. Okay, now Orem's theory of Orem's theory of self-care deficient. Okay, that we call Orem's theory. Okay, Orem's theory of self-care. And Imogen King, M. King, that is the goal attainment theory. Okay, this all theories we can see. This question asked in the mnemons. Okay, we'll move on to the next question. The trainee nurse is helping the assigned nurse who is providing the care to the kidney transplant patient. Okay, the trainee nurse asked about the type of isolation to be used for such patients: positive pressure, negative pressure, general room. Okay, then droplet precaution. Okay, positive pressure room, negative pressure room, then common general room, then option D is the droplet precaution. So, which room is suitable for the transplant patients? Okay, for the transplant patient we are giving always positive pressure or negative pressure. Okay, we are giving positive pressure. Okay, I will tell you why. See, this is the room. Okay, this is the room. Okay, so in this, suppose if we open the room. Okay, if you open the room, okay, pressure will come from the inside to outside. Okay, inside to the outside, from room to outside pressure will come, that is called positive pressure room. Okay, outside, that is the environmental air cannot enter inside. Okay, only in the from the room only pressure will come outside to prevent the why we are prevent. Okay, that is the immunocompromised patients. Okay, or any oncological patients, to prevent the airborne transmission or infection. Okay, because these patients are immunocompromised, immunity level will be where neutralize the immunity level. Okay, that immunity won't work with the this immunocompromised, that is the especially this one what oncology transplant patients. Okay, so we are neutralizing the immunity. Okay, that's why we are giving the positive pressure ventilation. So this is very clear. When we open the door of the room, so air will pressure, okay, come outside. From inside to outside, pressure will come. That is called positive pressure. Okay. Then negative pressure room, I will tell you. Negative pressure. Okay. So here patient will be there inside. Okay. So if you open the door, from outside, it will go inside. Pressure will go from outside to inside. From inside, nothing will come outside. Okay, from inside, air won't come from the inside. Okay, only in outside it will go inside. This, okay, this is the negative pressure. Okay, this we are using for the TB patients. So this is very simple. Positive pressure and negative pressure. TB patients and any airborne diseases will be there now. To take care of that patients, we are giving the negative pressure room. Positive pressure room only for the immunocompromised patients. This common general room we are giving common pressure and droplet precautions. That is one of the standard precaution we are taking for the patients. Okay. So hope you are clear with this. At question number 25, that is the to assess the sign of phlebitis over the intravenous site, which among the following score, okay, which of the following score is used by the nurse. Okay, so option A is the VIP score, option B is the flag score, option C is the Braden score, and option D is the NIPS, that is the pain score. So to assess the sign of phlebitis is always VIP. VIP score is the visual infusion phlebitis. Okay, this is the VIP score. This is the C 0, 1, 2, 3, 4, 5. Okay, 0 is always, so we are rating in our nurses note. Okay, that is the VIP score. VIP score of 0 by 5 is IV cannula looks healthy. Okay, so this suppose if 1 is there means any pain. Okay, any pain or redness, any one of the, okay, any one of the possible slight redness or pain near the IV side. Then suppose when we are giving grade 2 is the any 2, that is the pain or erythema or swelling near to the IV side, we are giving 2. Okay, then 3 means in 3 criteria, that is the pain, okay, then erythema or any induration 3. Okay, then all of the this number 4 we are giving pain along the cannula, erythema, induration, palpable venous cord, that is we are giving 4. We are not keeping, actually whenever we see grade 1 only we will remove the cannula. Okay, and suppose when we are giving this one 5 means that is all 4 plus fever. Okay, pyrexia we call. Okay, all 4 criteria plus fever means that is we are giving 5. See here they are given, so this also I will explain you. Suppose they may ask, okay, what is the, so VAP score is 1 by 5. What is the nursing management? Okay, so here we can see the possible first sign of phlebitis here. So we need to observe the cannula. Suppose if any increase in the redness, okay, or any pain, we have to remove the cannula. Okay, then this is the then number 2. Okay, number 2 will be early stage of the phlebitis. That is the again we have to reset the cannula, means we have to remove the cannula and we have to insert another cannula. Then 3, okay, 3 by 5 means what we have to do, that is a medium stage of phlebitis. Here also we have to reset the cannula, consider the treatment we have to give. Then this is the fourth one is the advanced stage of phlebitis. Okay, again same, here also we have to give the treatment. And here this one option 5, that is the score 5 by 5. Okay, so here piracy will be there, we have to send the culture also. Okay, again initiate the treatment and reset the cannula is the prior nursing actions. Okay, so we'll move on to the next slide, that is the flag scale. Okay, this I am explaining because of, see here we have mentioned flag scale, Braden scale, NIPS. Okay, so these 3 also I will explain you. Okay, so we know for the phlebitis we are using the VIP score. Okay, visual infusion phlebitis. Okay, so this is the flag score, that is the flag means, see, face, legs, activity, cry, and consolability. Okay, this is 1 to 5 score will be there. This is for the pain we are giving to the neonates. Okay, this is a flag scale. And one more thing, Braden scale. Braden scale, okay, one NORCET they have asked. Okay, so here is very very important. When the score is high score, okay, patient is healthy. Less the score, okay, so unhealthy. I will tell you 1, 2, 3, 4 will be there. See here, scoring between 15 to 16 is mild risk, and 12 to 14 is moderate risk, and uh, more than less than 11 is the severe risk. Okay, and this maximum score will be 23. Okay, 23 by 23 means that is very very good. So here, what are the things we are observing is the sensory perception, moisture, activity, mobility, nutrition, friction, and shear. Means how to assess the skin integrity. I'm telling. Okay, how this will happen. Suppose if patient is consciousness. Okay, patient is consciousness means, see, the sensory impairment, no impairment is a 4 we are giving, and moisture. So moisture also very rarely moist. Okay, suppose in bed, sometimes patients are doing the motion, urine, everything. Okay, so that we may see late. Okay, that also leads to the skin, what we call, that is a bed sore. Okay, bed sore. So rarely moist is the very good. Okay, constantly moistening patient, this motion constantly means, okay, that may lead to the bed sore. Okay, so that is very dangerous. Then activity, so completely on bed rest or patient may walk. This we have to see here. Okay, patient, yeah, patient walks means that is good. Okay, patient walking is, it is good. Okay, and this mobility, same, this is also completely immobile or no limitation. Then nutrition factor is very very important to prevent the bed sore. Okay, nutrition is excellent, so we'll give 4 marks. Okay, then friction and shear. And friction shear means, okay, shifting the patient one from one bed to another bed. Okay, so that is very very important. Okay, so this is the Braden scale of skin integrity. Okay, to assess the bed sore. Okay, and last one, NIPS, that is the neonatal infant pain scale. Okay, this is the same, uh, facial expression, cry, breathing, arms, legs, and alertness. So this is for the pain for the neonatal and infant pain scale. Okay, okay, so this is for the NORCET-9. So this time JIPMAR also included, so we don't know how the questions may come for the NORCET. Okay, so we don't know, because no, JIPMAR always has the critical questions, but now it has come under the NORCET. Okay, so we should be very careful with the all type of questions. Okay, if you have any doubts, you can comment in the comment section. Thank you.